So today I've invited Dr. Tom Minahan to join me. He's going to tell us this incredible story about his 11-year-old little daughter, Mallory. When I heard this story, I was frankly blown away, and I wanted to share it with all of our MRAP listeners. Tom is an emergency physician, a residency program director in Southern California, and father of 4. And his daughter, Mallory, suffers from intractable epilepsy. So thanks, Tom, for joining me today.
Thank you for having me.
So can you tell us about Mallory? Tell us this incredible story.
Mallory is 11 years old. She's had seizures since she was 14 months. She has seized as much as 12 times in a night. The worst scenario, probably 30 to 40 times in a month.
And what have you guys tried?
So when she seized at 14 months, we started with Keppra, pretty common drug. That didn't work, went to Topamax. That didn't work, went to another. Didn't work, went to another. Drug combinations. Over 10 years, we tried practically every drug out there. We tried everything. When I say everything, my wife bought a sheet for the bed that has wires through it that's connected to the outlet. It's called earthing. But for $200, what do you got to lose? So we've even tried that. A couple years ago, we tried the ketogenic diet, which at the time I thought it was snake oil. But it turns out the ketogenic diet, which is like an extreme form of the Atkins diet, cures 15% of the kids. So pretty good cure rate. No medicine touts that. So we did that for about a year and a half. Then last August, we go to see the expert in the world. My daughter's seeing, you're a physician, you have access to doctors and knowledge. Yeah, I'm very blessed. I got access to medicine. I go see the best in the world on the East Coast. So we fly back there at Johns Hopkins.
Okay.
So we fly to Johns Hopkins every 3 months to see the expert in the world for a 1-hour appointment. Because every time she seized, you felt like you were giving her the best possible treatment.
Sure.
So our most recent trip, she seizes at the airport. She seizes on the first leg of the flight. The second leg of the flight, they say, you really can't be on this flight. And I have to...
So what? Yeah, can I just stop you there? So what do the stewardesses do when you are in air? You like stick your hand out. You're like, I'm an ER doctor. I'm good.
So when she seizes, you try to disguise it. Now when she seizes, she makes a noise, as some people do as they seize, and so you just try not to let anybody know that it's going on because you don't want a plane to go short of their trip. You want it to get to your destination.
Right.
So the first leg of the trip, no one saw it. She peed all over the seat. We changed her clothes. She was post-ictal, and then we landed halfway between LA and Baltimore and changed her clothes and changed flights. And then my wife says to the next flight, hey, can we have a blanket in case she has a seizure again? And that was probably a mistake. So the flight, we get on, we get in our seats, and the flight's not taking off. It's delayed, and my wife says they're talking about us. I'm like, why would they talk about us? We're normal people. We have our daughter with us. Why are they talking about us now? The flight delayed and delayed. And eventually the stewardess comes back and says, hey, we need to, can you come up to the front of the plane? We got to talk. The pilot doesn't think you should be on the plane. Oh, geez, this is the last flight out. If you don't make this flight, we don't make our appointment in the morning at Johns Hopkins. So we eventually convinced the doc from Southwest that we're okay to fly. When she sees about a minute, maybe 2. We have rescue medications. We have rectal Valium with us.
And are they tonic-clonic seizures? Are they focal? Are they mix?
For years, we thought she had focal seizures. But we looked at surgery for her on a couple different occasions, and she actually has generalized onset. So when you have generalized onset, you're not a surgical candidate. You need a focal onset seizure to be a surgical candidate. So we land in Baltimore. She seizes a third time, seizes in the hotel 2 more times that night. So we go see the specialist that next day, and he says, sounds like you're not getting where you want to get with the ketogenic diet. But we tried. It's been a year and a half of weighing every single meal she ate. And she had everything was done through a computer program, a certain amount of fats, carbs, and stuff. And Christmas and birthdays, those are just disasters. You don't eat candy. That takes you out of your ketosis. So he says, you could do cannabis, but there's no real studies out there. And I'm a doctor, so I got to follow studies, right? He says, but I would try Felbitol. And most ER doctors haven't heard of Felbitol.
Yeah, I've never heard of Felbitol. What's Felbitol?
So Felbitol is a second-generation epilepsy drug. There's first, second, and third-generation epilepsy drugs. It's a second-generation drug. It has a risk factor, black box, for aplastic anemia. So my wife looks at the doctor and says, sure, you're the expert. Sure, you think Felbutol, we'll do Felbutol. He says, you only have to draw blood like every 3, maybe 4 weeks to make sure she doesn't get aplastic anemia. And I'm like, no, I will do Keppra again, I'll do Topamax again, I'll do Lamictal again, I'll do every other drug again before I did Felbutol. That was just me. So I come home, and we've hit a low of lows. Here my daughter's seizing 30 to 40 times a month. And mind you, like 6 months earlier at swimming lessons, I pulled her off the bottom of a swimming pool. It's been a rough road, and we just hit rock bottom. And then someone says, hey, have you ever tried medical marijuana? I'm like, come on. My kid's not going to smoke. I'm not going to have my 11-year-old kid smoke. And that was originally what I thought. Turns out it's an oil. So I read up on this. And I have learned more, sadly, as a physician from Facebook than I have from any journal or any text.
Well, let me just stop you there, because I think knowing you, and I think most who know you would probably say, first of all, you're one of the nicest people they could wish to meet, but more importantly, you live your life pretty conservatively, morally on the straight and narrow. So honestly, when I heard you telling the story, and you have a great Facebook video that's out there, a YouTube video, and you of all people supporting medical marijuana, I have to admit I was taken back a bit. So clearly you guys were at your lowest point in desperate measure.
I am probably the last ER doctor out there that would support medical marijuana, especially in the pediatric population. I've got to be the last. I am as conservative as you get. You don't see a tattoo on me. I've been married 1 time. I've got 4 kids. We go to church. We give our 10%. I'm as extreme as you get.
Yeah.
To do this was a huge leap of faith.
Yeah.
But I had nothing to lose.
And just to go for the list, and I'm not going to pronounce any of these correctly, you guys have tried ethosuximide, oxycarbazepine, valproate, lamotrigine, Keppra, topiramate, zonisamide, clobazam, locosamide, pregabalin. Clearly, I don't work for pharmaceutical, and 2 others that I won't even attempt pronouncing. And so you guys are clearly at a desperate point.
Yeah, and in fact, at one time, she was on 3 different pharmaceuticals, and still no relief. In fact, it was getting worse.
And you described seeing her having major side effects from those medications.
She would come down the steps one morning, and she was sitting there and had this tremor. I'm like, it's the side effect of the medicine. She just seemed to be slow at times on medicines. It was a side effect of the medicine. One medicine wouldn't let her sweat, so when she ran around outside, she'd seize. So don't be a kid, whatever you do.
And you'd taken her out of school.
She was seizing so much that, and she was not even alert really, to the point that she wasn't attending school. We had a home tutor coming in. What do you do? You can't put her in school when she can only attend 1 day a week.
Mm-hmm. Has she suffered any anoxic brain injury, do you think, from all these seizures?
I don't know. She's never really been in status. She sees as much as long as 2.5 minutes at one point, I remember. It's hard to know. It's hard to know. What's worse, the seizures or the drugs?
Yeah. So Mallory has had 30 to 40 seizures a month, up to 12 a day.
So I watched this CNN special by Sanjay Gupta, who was a neurosurgeon, and I look at it and I'm like, well, what I got to lose? It's pretty safe. People have been smoking it for 40, 50 years. Some people actually function and smoke it. But I honestly said, I've never seen anybody have any success from this. Everybody's getting high. That's what we see in the ER. You know, they have the back pain. Sure you do. You walk in here, you look just fine, but you're smoking the weed. I get it. Okay. So I think a large number of people, sadly, use it as an excuse for recreation. They say it's a medical thing.
Mm-hmm. Well, we know it has some effect on cancer patients for pain control and appetite.
I agree.
Yeah. Your neurologist then offers cannabis, and what is your initial reaction when you heard this?
The neurologist says you can do cannabis. This is back in the East Coast. He's not in California. So I come out to California here, and I look on Facebook, and I'm like, what are the parents doing out here? Well, you read up, and kids are being dosed at 3 milligrams per pound. Not kilos, it's pounds. And that's sort of the standard out there, which is very foreign for us. And I look around, I find this doctor I'm supposed to go see. I go see him. I pay him the $175. I go in with my daughter, who's a functional 11-year-old kid. We go in, and in the interview, he drops an F-bomb 4 times in front of her. So, geez, look at this kid, man. You can't do that to this kid. We go then send this card, shall we call it, into a dispensary, and then they mail you this oil. And the oil we put her on is called AC/DC.
So you're giving your kid AC/DC oil.
Yeah, by a doctor who decided to drop an F-bomb 4 times in front of her.
Right.
So it's hard to take this seriously, but I've got nothing to lose. So we spend $200 on a bottle of oil. It shows up. And do I really know what's in it? I don't. It doesn't come with a seal on it. It's just a bottle with a twist top on it. There could be anything inside it. So...
And how do you give it to her?
It comes in a dropper, and you drop about a milliliter, and you put it in her mouth.
Okay, so she's not smoking 3 grams.
She's not
drinking
smoking.
it. Okay.
She's taking it.
Okay.
Actually, it's better
Orally.
absorbed sublingually.
Okay.
And so we try to put it in her mouth and make her hold it in her mouth as long as she can.
What does she say it tastes like?
Oh, she thinks it's nasty.
Yeah.
But when she was on the ketogenic diet, she was on a bunch of supplements. She was putting away about 10 pills twice a day, along with her other meds. So taking an oil in her mouth that tastes nasty is probably nothing for her at this point. So we put it in her mouth and 3 times a day, and then the people who knew her, hadn't seen her like on a daily basis, they'd see her like once a week. This one lady says, "There's something different about her. I don't know what you're doing, but keep doing it. There's something different about her." So they didn't even know the seizure frequency went down, but this alertness, it's like she woke up. It's like the lights got turned on.
And you said she's back in school.
So she was in school. Now she's attending school full time, 5 days a week. I say she was seizing 30 to 40 times a month. She has seized only once in the last 13 days.
Wow. How has this changed your life and your wife's life and your family's life?
Well, we're pretty conservative, and I'm guilty. I judge those people. I'm guilty. We're all guilty of judging people. But you see them in the ER with the marijuana. They reek of marijuana, and I'm like, come on, people. I have a little more open knowledge. I'm thankful for those people who've been smoking weed for the last 40, 50 years. My daughter would not have the seizure frequency today if it wasn't for all those people smoking the stuff for the last years and pushing for it in California.
Yeah, I think as a physician and as an ER physician, I knew nothing about cannabis in pediatrics. And I think if you were the parent of a patient of mine that came in through the ED and you told me as a parent that your kid was using medical marijuana, that I'd be inclined to report you to Child Protective Services.
And there are a fair number of parents out there are afraid to tell their doctor that they're actually using this
I'll
because
bet.
they're afraid that Child Protective Services will get involved.
Yeah.
And so they keep it quiet, sadly. But if they had told me that 8 months ago, I'd be like, you're crazy.
Yeah.
You're getting your kid high.
Right.
Now, I'm all about it.
So what have you learned? And I know there's limited research out there, but what have you learned about how THC works and marijuana works? Do we know?
In the strain that she has, there's cannabidiol. So THC is what gets you high. So she is on a strain that has very low THC. In fact, there's less than 1 milligram per ml of THC. The CBD, or cannabidiol, is about 15 milligrams per ml. So she has very little THC in it, but there is CBD, or cannabidiol, and the cannabidiol is thought to have the anti-epilepsy, anti-inflammatory properties. It's really not known, but I was unwilling to wait 5-10 years for studies to come out to prove what it was.
Sure.
For my daughter.
Sure. So, and you mentioned there's a study going on now in California?
So there's a company over in Europe that grew a bunch of these plants with its very high CBD and very low THC. And it's GW Pharma. And they now have 50 kids in a study in the U.S., 25, I understand, in San Francisco and 25 at NYU, who are on this medication, which is almost no THC, very, very limited trace amounts of THC, if any. Some are doing very well, some so-so, and apparently some not so well, as with any medication.
So it's spring of 2014. So where we stand currently in California, how do you get this stuff?
So a dispensary has my daughter's information, and I email them, and they send me a bottle, and then I send them a check. And I ask them, suppose I don't send you the check after you send me the bottle. They said, we'll never send you a bottle again. They don't deal in credit cards because federally this is Schedule 1, so it is in the same category as LSD and heroin. So there's no medicinal value.
Wow. So what is your hope and what is your mission, I guess? You developed a foundation called Mallory's Hope, and that's what's on Facebook, and you're trying to get the message out there. What is your hope for Mallory and this foundation you started?
So I'm fortunate to have access. I have access to physicians, and I'm financially more comfortable than the average person. What's the average person do? They go to the doctor, and they say, do this drug, and then this drug, and then this combination. More people need to know about this. More doctors need to know that this is actually something seriously worth trying on a kid. It's safe. It's $200 for a bottle. It cost me for about a week and a half for my 11-year-old. It depends on where you go, how much you pay for what you get. More docs need to know about this as legitimate. Mm-hmm. Not everybody, as I used to think, was using it to get high.
Do you have a sense as to what the neurology community feels about CBD?
The majority of the neurology community, so I hear from parents, is they're very much against it. And so most parents won't tell their neurologists they're using it. You need to find the select neurologist who is open to the idea. Most will never write for it. Some will say, we'll follow you along as you're on it, but we will not prescribe it. Some people have been threatened with Child Protective Services if they're in a hospital and they want to give their child their home medicine, which is the CBD oil.
What do you hope to see within the medical community in the next couple of years?
Hopefully, they can help the government change this to schedule something out of Schedule 1. So my daughter technically cannot travel. She can't travel with her meds, so she really can't travel. So if I take her out of state, she has the risk of seizing, so we can't travel with her. That's huge. Also, there needs to be some regulation with it. We get bottles in the mail, and it says 15 to 1, 15 CBD to less than 1 THC. And there was a bottle once that came completely opposite. It had 15 THC to 1 CBD.
Jeez.
Another time it came, and it says less than 1 milligram of THC, but the less than sign was reversed. Who's filling this stuff out? Another time the medicine shows up, and I knew it had shown up because the envelope that it showed up in was so impregnated with marijuana smell, you wondered who was getting high, why they were packaging. So what did they really package? So you give your kids something, you really don't know what's in it sometimes. And also, pesticides and molds. Yeah. There's parents who have had oils that within 4 days start growing mold on the top of it. So your kid's already sick, and now you're going to put mold into them 3 times a day?
Right. So it needs to be regulated. It needs to be FDA approved. You need major studies.
Yeah, but you can't, I couldn't wait for major studies. Jim Abrams, who is a big proponent of the ketogenic diet, he directed the movie Airplane. His kid had epilepsy, and he came out with a statement yesterday saying that if his kid had waited for the ketogenic diet to have a major study, his kid wouldn't have been 20 months. His kid would have been 17 waiting for that study. His kid at 20 months was having 20 to 50 seizures a day. On the ketogenic diet, became seizure-free. He says you can't wait, and you shouldn't wait. And as a parent, I wasn't willing to wait.
I hear you. So although modern medicine has yet to figure out its seemingly positive effects, I think your story certainly opened my mind, and I think it's important for the EM community, who I think is actually fairly liberal and open, to also at least just be open to it if they have a patient that comes in on it. So thanks for sharing your story, and we at MRAP wish you and Mallory's Hope all the best.
Thank you.